So good morning, everybody. And today's been 304 days since the outbreak of March 12th. The light is at the end of the tunnel. Hope is there. We're almost there. The vaccine's out. We just got to roll it out better, and we need partnerships to roll it out. But I want to do an update of COVID-19 before I get into the partnership that we're going to be announcing here. And unfortunately, we lost a resident last night, and it is now the youngest resident we've lost since the outbreak of COVID-19. A young man in his 20s. My condolences and prayers go out to the family. It's a hard time to lose anyone, and it's a hard time now in these troubled times we've had for the last 10 months to deal with a loss, any loss, whether it's with COVID-19 or just any loss from anything, and to reimagine the world we're in. As I like to remind people, sometimes you just got to take a step back, take a deep breath. Remember, it's a marathon, not a sprint. But most importantly, we're getting there, and we'll get through this because we're resilient. We're resilient in the Albany County. We're resilient in the state of New York, in this nation, and we'll beat this. But unfortunately, that now brings people that passed away from COVID-19 to 250 in our county. The number of positive cases are reporting each day have been near or around 300 consistently since the first of the year. The highest we had was 346. As of today, 14,116 people have coronavirus in Albany County to date. That's an increase of 279 positive cases. So 14,016 cases of COVID-19 to date. The 5-day average is 276.6 new cases every day. Yesterday it was 272.2. There are currently 3,204 people under mandatory quarantine. Yesterday, that was 3,086. Of the new positive cases, 36 had close contact to a positive person. 14 are healthcare workers. 229 do not have a clear source of infection of this time. As of today, 42,751 people now have completed quarantine. 11,961 of them tested positive for COVID-19 and had recovered, which is good. That's an increase of 286 recoveries since yesterday. Last night, which we've been watching the hospitalizations, we had 13 new hospitalizations overnight. There are now 147 people currently in the hospital from the virus. Yesterday it was 149. Unfortunately, there's still 11 patients in the ICU. The day before that was 12. Our numbers of new hospitalizations has been lower the past 2 days than before, but our numbers are still overwhelming. If you look at the capacity at Albany Med, I believe they got like 147 COVID-19 patients, and they're looking to move patients around and consolidate floors to make room. It's the thing we've been working with the 8 regional hospitals in the Capital District to make room for COVID-19 patients that are recovering that can't get discharged, so we can keep the capacity of our main nursing home or hospitals available. So please, stay at home, work remotely, pause if you can. It's what I've been saying since the beginning. We're in this together. We can get through this together, but we need to think and operate differently than we have in the last 300 days, and we'll get through it. So if you can stay remote, stay remote. If you don't need to go out, don't go out. Please use our local businesses. Please shop. But you can do it a variety of different ways now. Curbside pickup, deliveries, you name it. Groceries can be delivered. You can shop online with all the local stores, not just here in the city of Albany, but all over the county. Please do it. As we know, we're still in Category 1A. Starting on Monday, the state will be signing people up for 1B category while still prioritizing healthcare workers in other 1A. We just got notified. I was just talking to Dr. Whalen before I got here. One of the things the state's finally doing, and Mayor Sheen brought it up, and we've been talking about this for a while, is having a sign-up. So on Monday at 1600, you will have a calling number for people that can't use computers or don't have the technology. 8 a.m. starting Monday, they will be able to register on a website. Please be patient. It's probably going to be overloaded, and it's new starting on Monday, so the people that fall into Category 1B can sign up to get a time to get the vaccine. But This means we get vaccines into the arms of our seniors and first responders. One of our main priorities of this phase of joining the governor and our governor here and the 8 other governors is to call on the federal government to get more vaccines. The more vaccines we get out, we can get it out to the groups of people here in Albany County, to the places where it needs it, the shots in the arms, and the 75-year-olds that start on Monday, and which is one of our most vulnerable populations. One of the things that we have identified too, there was no list to sit there and go, hey, we have all these 75-year-olds. And then you have to be able to have the 75-year-olds either get here or do a drive-through, and makes it impossible. And some seniors, and I can tell you this, I'd like to do a poll, how many people haven't left their house in 10 months? How many seniors have not come out? Now we got to try to ask them to come out and get the shot. So we've been putting the list together for the last couple of weeks here and trying to identify all of them in Albany County. But more importantly, trying to identify seniors that live in congregate settings that don't fall under the state law or county laws or no oversight of anyone, because they might just be in housing, they might just be in an apartment complex where 65 and above live there. And if there's an outbreak, no one's saying anything to us. If there's people in the hospital from COVID-19, no one's saying anything to us. And we've seen that happen with the COVID. And this is something we need to address. And I did talk to Assemblyman John McDonald about creating a law. So in times of crisis, health crisis, we can identify these places. They will have an obligation to make sure that people in them apartment complexes or settings have information on what's going on with the health emergency. And more importantly, that company would have to direct to the county health department in a state of emergency that they have X amount of seniors and this is the issue going on in their apartment complex. So I want to thank John McDonald for taking care of that. So the reason why we're here is partnerships. Partnerships get things done. And I want to thank Mayor Sheen and her team and Mohawk Ambulance and their team. Something we've been working on, something we've been talking about, and something to identify. But I also want to thank Tom Nardacci. I don't know where he went. He's probably hiding now. I want to thank Tom, again, for your compassion. I've known Tom a long time, since he went to a senior prom in high school. And I have to tell you, he broke down on the phone and talking about seniors and exactly what we're talking about. Not the ones just sitting in nursing homes or categorized under the state or county, but seniors that just live where people can't get to them or they don't have anyone advocating for them. The ones that are falling through the cracks. So as we go forward, this type of partnership will make sure that they don't fall through the cracks. This partnership will make sure that we get the vaccine in their arms at their location. Not coming to a drive-through, not coming to the Times Union Center or any other pod going on. We will make sure if you can't get to us, we'll get to you. So Mohawk Ambulance has over 150 employees working together in a partnership to identify these individuals. They have the capacity of taking over 300,000 vaccines now. So to Governor Cuomo's call on us working together, we're ready, Governor. We are ready, willing, and able. So Mohawk Ambulance not only has the capacity working with and I want to thank Dr. Whalen too, Dr. Whalen, her team for making this happen, and our Department of Aging and our Department of Health and Social Services, because it takes everyone in a partnership, and Mayor Sheehan and Mohawk Ambulance, to identify these people, but to make sure the left and right hand know what each other's doing. And Mohawk for their leadership. They already got signed off, and I'll let Javon talk about it, but they already got signed off from the federal government. So we got federal approval. They're trained on the federal side. They just got the MOU yesterday from the state health department, DOH. They're ready. We're ready. So we get these vaccines tomorrow. We can get them to the shots of the 75-year-olds that need them, that can't get out of their apartments, can't get out of their houses, nor they don't want to. You look behind me, that's going to be the solution. Us coming to you to get shots, not you coming to us. It's nice to set these pods up. It's nice to do drive-thrus, but let's face it, people live in cities. because of transportation. And I thank the men and women in CDTA for what they've done day in, day out since this has happened, and still going to work every day, getting people to work. But seniors aren't going to take transportation. They're not going to take Lyft. They're not going to take Uber. They're not going to take a taxi cab, even if we have them anymore. I don't even know if we do here, to get to these sites. They're afraid to come out. Or they don't even know this is going on and how to get the shot. They have no clue. And you know what? Rightfully so. They probably don't know who their politician is or who anyone else. And God bless them. Who cares, right? But we have an obligation to make sure we know who they are, identify them, and get it. I want to thank the partnership with the housing, not just here in the city of Albany, but all the river communities in the county. We've been negotiating with them since December on this type of thing, to identify people, to make sure people don't get lost in translation. So I do want to thank Mohawk and in being able to do 300,000 vaccines, and we can get them out. And I'll let Javon talk about that in a minute. We'll be able to get it out in a partnership with the mayor, and I'm going to bring the mayor up in 1 second to talk about the partnership with the city. And again, it takes everyone working together. It's just not my team. And I do want to thank my deputy, Dan Lynch, and Jeff Jameson, and George Penn, and Mary, and Cam, everyone, Mike McLaughlin. It takes all of us working together. Leave the egos at the goddamn door. Leave the problems at the door. This is about getting solutions for the people that we're representing, and this is about taking care of people. It's not about politics. It's not about who did what first. It's about working for the people and taking care of them in a crisis like this. Mayor Sheen.
Thank you, County Executive, and I want to really thank the county and Mohawk Ambulance for listening. When we started on this road that we are on, when the first 2 cases, positive cases, were detected in Albany County, we began to work together in a way that is best for our residents. We needed to acknowledge and recognize that in Albany County, which the city of Albany is a part of, our health department sits at the county level. And the last thing that we wanted to do was to confuse people or to trip over one another with respect to how information was going to be disseminated in Albany County, with how testing was going to be disseminated in Albany County. And when you look at how we've been able to work together to get testing at various sites, walk-up testing in the city of Albany, the county has been incredibly responsive. And so as we saw that a safe and effective vaccine was going to become available, the conversation around how we were going to ensure that those same vulnerable populations that needed access to testing were going to have access to the vaccine. And the only way that we can do this is if we do it together. And when we look at the opportunity, you know, the governor wants us to quickly get these vaccines in the arms of people. Well, there is a tremendous opportunity in our senior populations to be able to do that effectively. If a senior, a 75-year-old, is living at South Mall Towers, they should not have to separately go to different places and find different places to get the vaccine. We can come to them. And through this partnership with Mohawk Ambulance, we have the ability to go to South Mall Towers, to go to Ohav Shalom, to go to the various senior communities where we can safely distribute this vaccine and not have people have to try to navigate their way through which site they can travel to. And to County Executive's point, many seniors are afraid to go out. They will not take public transportation. They will not get in a taxi. And we have to recognize that that is a barrier to accessing the vaccine if the only way that we're going to be distributing this vaccine is by making people come to a pod. And we have the opportunity to, as we have identified very quickly, there are a number of senior 65 and over communities, apartment complexes throughout Albany County. And we want to make sure that we are moving rapidly and that we are providing the opportunity to get vaccinated within those communities now that we've moved to 1B, so that as vaccine becomes available, we are able to ensure that it is getting to the people who need it the most. We also have talked, the county executive and I, about the 1As. We believe that there are still a lot of people who fall into the 1A category who have not been vaccinated. And unfortunately, it's those lower income healthcare workers, health aides. Some of them are working and going from patient to patient, and they may not have the time. They may not know how they can get this scheduled into their schedule. And so we want to ensure that we're providing that information as well. We need to get people vaccinated. We have a safe and effective vaccine. We have an end in sight. We need to continue to demonstrate and exercise personal responsibility to keep ourselves and our families and our communities safe. But with this partnership, we believe we are going to be able to quickly and effectively vaccinate some of the most vulnerable people in the city of Albany and in Albany County. And this is what working together looks like. So thank you, County Executive. Thank you very much, Mohawk Ambulance, and to everyone who's going to help make this happen. We know that we may need to augment some of the resources at Mohawk Ambulance. We are going to train our firefighters in being able to administer the vaccine so that they are able to do that. We are also going to ensure that we provide resources to help, whether it's with phone lines, whether it's with the data entry, as we roll this out. We are standing here ready to support the needs of Albany County in order to be able to get this done and to get it done quickly. Thank you.
Thank you, Mayor. And again, that's what partnerships are about, working together for everyone, because we're all in this together. And we'll get through this working together in partnerships with this that we're announcing today. But Javon, I want to say thank you to Mohawk for everything, for stepping up to the plate, not just here in Albany County. You got to understand Mohawks in Rensselaer County, Schenectady County, Saratoga, I believe, which pretty much represents the million people in the Capital District. Who better that have been a fabric of our community for many years, out there taking care of our people when you get hurt. You know, when you need an ambulance ride or you call 911. Mohawk's been there on the front line taking care of the people of our community. So thank you to Mohawk Ambulance and everyone involved with this initiative. But, Javon.
Good morning. I just would like to say thank you to the county executive and the mayor for having us here today. This is a great opportunity for all of us, and we're very excited to provide part of the solution to vaccinate the many citizens of the Capital District, especially here in Albany County. Mohawk Ambulance has been going through this process for several months now of obtaining the vaccine, obtaining the equipment needed to house and administer the vaccine. At this point in time, we are ready to move forward. We have purchased ultra-cold freezers in case we have to handle the Pfizer vaccine. We have standard freezers for handling the Moderna vaccine. We believe we've covered all of our bases, so no matter what comes our direction, we're ready to handle it. It's always been a goal of Mohawk Ambulance to bring the highest level of patient care to their doorstep inside of their home, and this is just another way of doing that. The pandemic has kept everyone inside of their homes. Healthcare has changed. We are now doing a lot more inside the patient's home, trying to keep them there instead of transporting everyone over to the emergency department. Again, this is just another way that we're doing that. We're now going to start bringing the vaccine to the patient's home, keep them safe, and continue to carry out that mission. We're ready to go. We're going to get through this together, and we're looking forward to this excellent partnership. The public and private partnerships that we develop have definitely been a top-tier solution to a lot of the problems that we've overcome over the past several months. So again, thank you to the county executive, thank you to the mayor, thank you to everyone in the Capital District for supporting us, and we're looking forward to see you out there in the very near future.
So it just shows you how modest Mohawk Ambulance is, because they are a big factor and fabric behind this. If you look at over my left shoulder, that rig is going to be pulling a trailer all over the county, all over the Capital District to get vaccines to where they need to be. the ambulance also, bringing workers out to housing places that Mayor Sheen and our teams have identified throughout Albany County to make sure, first and foremost, every 75-year-old gets the shot first. I know everyone wants it. I keep getting phone calls constantly, people saying, when am I up? When can I get it? I have elected officials asking that question. I'm like, the way we read it, 1C. The way I read it, 1C. And one of the things that we continue to really pinpoint is people with have disabilities, people that are home that are sick, people that are being cared for by workers coming in. When do they get it? You know, I have a sister-in-law who has ALS that has aid around the clock. When does she get it? I don't know. 1C, the way I read it, but our healthcare worker now can get it. These are people that need it, that we don't want falling through the cracks. People that are home being taken care of by their loved ones, that are taking care of them. Well, you're home healthcare. You're taking care of your mom, your dad, your sister, your brother, your wife, your husband, that might have underlying health issues while you're taking care of them. You should come get the shot, because we have to make sure no one falls through. And that's one thing I will say about Tom Nardacci's passion when we were talking about partnerships a while ago and going through all this, is making sure we remember everyone. And again, we're government. You may fall through the cracks. Help us help you. Please, help us help you. Be part of the solution, not part of the problem. It's easy to sit there and complain and point fingers. But the people need action. The people need action now. So I'll again say to Governor Cuomo and his team, thank you. To the state DOH, thank you for making this possible. To the federal government that got this done for Mohawk, thank you. They're willing. So if we can get 10,000 vaccines this week, let me tell you, they will get in arms. And it will be done quickly and seamlessly. And that's what it's about with this partnership, with the coordination of everyone on the same sheet of music. Be it if we set up the drive-through, or we sit here at the TU, or at your house. We'll come to your house. To everyone, help us help you. People that are watching this that have seniors living in their apartment complex, call us. Call the mayor's office. Call my office. Identify yourselves. Protect the people that are paying you rent every month. Protect the people in your building that are paying for your taxes and your lights to be on your building. Help us. And if they're not even in an apartment complex, if you live in a 2-family, a 3-family, let us know, because we want to make sure when this opens up, we get it out to everyone. So again, I do want to thank Mohawk Ambulance again for always being on the forefront and being part of the solution, not part of the problem. Last week, according to the governor, 29% of the capital region's 1A population has been vaccinated, or 31,000 people in the region. The highest was the North Country at 37%. With that being said, we need to get the numbers higher, and we are ramping up, and we're here, and we're ready. So that vaccine gets here. I think we have 1,000 coming in this week. When I talked to Dr. Whalen, that will be a bigger pod for us and going forward. Now we got great partnerships here to make sure if you can't get here, we're going to get it out and get more vaccine out when it's available. I do want to thank Dr. McKenna and Albany Med for the great partnership. I know this has been all new to them. I know it's been a trying time for all the hospitals, but to Dr. McKenna's leadership and getting it through, thank you for all that. And to everyone that's getting it done, thank you. And you got to remember, I always like to you got to lift yourself up every day, even when everything's being thrown at you, when everyone's talking negative about you, or everyone's saying you're not doing enough, or you know you don't know what you're talking about. You just got to remember one thing, man. You got to laugh to get through the day, and you got to smile. And you know what? You take what's thrown at you, and it only makes you stronger. So I will say this, please, everyone remember, we're there for you. We're there to help you. We're there to listen to you. But most importantly, I'm there to work for you. But I'll say this, all human wisdom is summed up in 2 words, wait and hope. Well, the waiting's over, the hope's here with this partnership, and we're going to get this done. So our testing sites with Whitney Young, as always, please reach out to them. We cover it if you don't have insurance, 518-465-4771. We cover the cost. University at Albany, 188-364-3065. And to albanycounty.com, go there, you can see the testing sites. I know I got some complaints the other day. People were saying they couldn't register to get online to get the vaccine. I'm going to look into that. So, and mental health support for the people that need it. And I mean this, the world's different. Everything's different around us. And as I said, time and time again, the decisions you make today, don't let them haunt you in the future. Don't let them haunt you in the future. Just take a step back, take a deep breath. Remember, we're all going to get through this together in partnerships, together leaning on one another. Call our mental health department, 518-269-6634. Please have your children call. If we can't handle it, we'll get you to someone that can. It's important to take time to talk to your kids, regardless if they're 5, 6, 7, 8, and so forth. It's difficult for them. It really is. Just think of what you're going through and imagine a kid who can't play sports, can't get out to play with friends, can't go to school, hasn't socialized. It's tough. Just take the time. Kids, I'm not giving you the free card to go out and just be a little bit more crazier with your parents because of what's going on. And we all will get through this working together. 24-hour sexual assault hotline number, 518-447-7716. Our partnership with United Way to Pecan and other things we'll be announcing together. Pete, thank you for the partnership. New York State hotline, 188-364-3065. I want to say this to Mohawk, to Mayor Sheen's office, to Dr. Eliza, or Whalen, sorry, I was thinking first name, and to the health department and aging and everyone that's been involved. Thank you. Thank you for this partnership, to the housing authorities, to everyone we've been working with. This has been a long time coming. Governor, we're ready. We're ready to work for you. We're ready to get the vaccine out there, get shots in arms, and I'm glad some of the guidance have just changed. We're going to read it, so I don't want to announce it, but I'm hoping that it's the way we want it so we can make sure that we will not waste a shot. We will get a shot in someone's arm. Be safe out there. Wear your mask. Stay 6 feet apart. Cough in your arms. Clean your hands.